Important points before you move forward. We need to know some short forms that are must to know. SABA is the short form of short-acting beta agonist. For example, salbutamol. ICS is the short form of inhaled corticosteroids. For example, fluticasone, betamethasone, and beclomethasone. LABA is the short form of long-acting beta agonist. For example, salmeterol, formoterol, etc. Leukotriene receptor antagonist is called LTRA. Molteleucast is an example. MAR therapy is the maintenance and reliever therapy in one inhaler. It is a combination of ICS and LABA together. LAMA is the long-acting muscarinic antagonist. For example, tiotropium. First line in asthma management is inhaled salbutamol, which is common in both NICE and BTS guidelines. When do you start inhaled salbutamol? Indications are relief is only needed once daily, no nighttime symptoms, and no impairment in lung function. Next step after adding inhaled salbutamol according to NICE guidelines and BTS guidelines. In NICE guidelines, we add inhaled corticosteroids after it. The indications when salbutamol PRN did not resolve symptoms, here pre-RN means when necessary, or salbutamol was required more than once a day for symptom control. In BTS guideline, we also add inhaled corticosteroids. Here the indications in BTS guidelines are symptomatic patient 3 times a week or more, or waking 1 night a week. Using inhaled SABA 3 times a week or more, and have had experienced asthma in last 2 years. If the patient need maintenance therapy at the start, then initially we start with low dose ICS and SABA together. BTS treatment protocol for adults who are aged 70 years or more. First step for suspected asthma is SABA with monitored inhalation of ICS. Second step for confirmed asthma is SABA with regular inhaled low-dose ICS. Third step, with the second step, we can add LABA as a fixed dose or as a mild regimen. Next, fourth step. With third step, we can add LTRA or we may increase ICS to moderate dose. At this fourth step, if patient is not responding to LABA, we can consider stopping it. If asthma is still uncontrolled, next step is referring to a specialist. NICE guidelines on asthma management for adults who are aged 17 years or more. At the first step, we have 2 options. Option 1, we may start with SABA alone, and if patient has not controlled asthma over 4 to 8 weeks, we can give low-dose ICS with SABA. Or, as option 2, we can start together SABA with low-dose ICS. If asthma is not controlled over 4 to 8 weeks, we'll go to second step, where we add LTRA, that is montelukast, with SABA and low-dose ICS. If asthma is not controlled over 4 to 8 weeks after the second step, we go into third step. Here we give low-dose ICS with SABA, with LABA, and as an option we can add LTRA. So here we are adding LABA and LTRA becomes an option. If asthma is not controlled over 4 to 8 weeks, at the fourth step we start MAT regimen, which contains low-dose ICS and LABA. And LTRA is an option according to patient preference. If asthma is not controlled over 4 to 8 weeks, even after fourth step, we go to fifth step, which contains maintenance therapy and reliever therapy, as like previous steps. Maintenance therapy contains MAT, which is moderate dose ICS and LABA with LTRA as an option, and reliever therapy contains MAT, that is low dose ICS plus LABA or only SABA. Or as an option, we can make the MAT therapy into a fixed dose. That means we can give fixed moderate dose ICS plus LABA plus minus LTRA, and reliever therapy is the same. If asthma is not yet controlled over 4 to 8 weeks after the fifth step, we go to sixth step. At sixth step, we have 4 options. In option 1, we may give fixed high dose ICS with SABA, with LABA, and LTRA as an option. Or as option 2, we may give the patient moderate dose ICS with SABA, with LAMA or theophylline. That is option 2. Or as option 3, we can give the patient moderate dose ICS with MAT regimen that contains low dose ICS and LABA with LAMA or theophylline. Or we may go to the fourth option, that is seeking expert advice. Now it is important to know when to switch from one treatment step to the next treatment step, simply when the patient has uncontrolled asthma. For example, if patient has initially uncontrolled asthma, we start treatment, and at any treatment step is asthma is uncontrolled, we go to the next step. What is that uncontrolled asthma? Asthma is called uncontrolled when it has an impact on person's life or it restricts their normal activities. NICE has a threshold for uncontrolled asthma, which is any of the following: 3 or more days a week with symptoms, 3 or more days a week when requires the use of salbutamol for symptom relief, or 1 or more nights a week with awakening due to asthma. Now let's simplify that. We give a treatment to the patient and monitor response for 4 to 8 weeks. If these NICE thresholds are present, we go to the next step of treatment. Now, some more important points from the guideline. These are other treatment options. If persistent allergic asthma, add omalizumab, which is an anti-IgE monoclonal antibodies. If above therapies, including inhalers like salbutamol, LABA ICS, theophylline, LAMA, omalizumab, do not control asthma, try oral prednisolone. Remember, even if the patient had taken prednisolone for other purposes, he or she should follow the treatment steps discussed earlier before adding prednisolone. And if asthma patient is hyperventilating, try diaphragmatic therapy.